Welcome to the Voice of Reason channel. Be sure to like this video, plus follow and subscribe to the channel to see more great content. Also check out all of our show pages on Facebook, Twitter, Twitch TV, Getter, Truth Social, Instagram, and TikTok, all at Who's Your Reason. Make sure to tell your friends, spread the word of reason, and enjoy. Plus, become a supporter of the show by signing up on our Patreon account to get special access to additional content not heard on the show. It's time for you to become the ultimate Hoosierholic. For more information, find us online at HoosierReason.com. Again, there's been some hearings in Washington, D.C. regarding the pharmaceutical industries, obviously. And have you seen the amount of money that they've been making on these vaccines? But they're free. Yeah, if you believe that, then you have another thing coming for you as well, because they're not free. The government's been paying them for you so you can get it free, all thanks to the wonderful federal government. The question is, how much are they, and how much money are they making? And now we have hearings about trying to cap the price of the vaccines and other pharmaceutical pills as well. Remember Joe Biden coming out and saying, well, we need to cap insulin at like $30, and we need to cap it to where they can never raise it again, which was already done in the prior administration.
That's right. Donald Trump did that.
That's right, but it wasn't good enough, so we had to reverse it, and then we had to do it again in our own special way. To talk about some of this and more and what's going on in Washington, D.C., really happy to have on the program. She is with the Pacific Research Institute, following all this and more. Miss Sally Pipes on the line with us here. Sally, how are you today?
I'm well, thank you. How are you?
I am living the dream, and I appreciate you so much coming on the program. It's a fascinating conversation of how much are the pharmaceutical companies really charging for the vaccine, especially the COVID-19 vaccines that we've been forced on us over the last few years. How much have they really made from this? Because I've been hearing reports of record billions of dollars of profits from this pharmaceutical industries when we're being pitched that, hey, this is totally free. You don't have to worry about a thing on these things, right?
Well, probably wrong. The thing that you have to think about is, the number of drugs that go into the number of companies that go into trial to get drugs approved by the FDA, and it's very, very few. In fact, it costs $2.8 billion to bring a drug from an idea to the market, and 90% of the drugs fail, and so we're looking at your opportunity to make a return on your investment is very low. And if you look at a company like Moderna, where, the Senate Bernie Sanders, chair of the Senate Health Committee, held the hearing on March 22nd into the price of Moderna's drug. I mean, you have to look that in 2011, Moderna started their investigation into and research into the mRNA idea. By 2016, they'd had 11 drug candidates and more than 90 preclinical trials. Not one of them made it until 2020. When the FDA approved the Moderna vaccine. So there's a lot of risk in this business. Very few drugs get through, and you have to look at what is the return on investment. How long does the patent last? And then the drug or vaccine or whatever goes generic. And of course, it is much cheaper. But companies have to A, take the risk, and B, they have to make a return on investment. That's what makes America great. We're a country of innovators.
Yeah, no, that is very true. Now, correct me if I'm wrong. I don't know because I haven't heard about it in a while. Is the actual from Moderna, from Pfizer, some of these that use the mRNA technology for their COVID vaccine, are they still in the quote-unquote trial period, or have they actually been approved by the FDA to be considered a legitimate vaccine? Because the last I heard, I thought they were still in the quote-unquote trial period and never actually got approved.
Well, the original drugs were approved within 42 days. They were approved for authorization but they were actually approved, and now we're seeing a company like Moderna has got some really interesting cancer vaccines and cancer drugs on the docket, which for those of us who worry about getting cancer and have had relatives and friends die from cancer, we really need the new therapeutics which are being developed here in this country. None of these new therapeutics, CAR T therapies, these vaccines even, are developed in countries that have price control. I'm from Canada. I mean, my uncle died from non-Hodgkin's lymphoma because Rituxan, which was the new drug here for NHL, was not even available in Canada in 2003. And the head of the cancer agency said, well, you can go to Seattle and go to the Fred Hutchinson Clinic. America is where all of this work is done. and it's not done in England, it's not done in France. We need to keep the pipeline open for the latest therapeutics, so that that we can all live longer and healthier lives, and take pills for things like cancer rather than having to go through horrible things like having to have radiation therapy or chemotherapy, which are very devastating and debilitating.
Yeah, well, there's a reason why there's people all over the world that try to come to the United States for our health care, because even with our issues, which I believe they're getting worse under Obamacare and the government centralizing a lot of that power in the healthcare industry, we're still one of the best ones in the world, which is why people love to come here. But it really bothers me that Bernie Sanders would be the head of a committee on health here in the country. So during these Q&As with Bernie Sanders at the helm against some of these industries, what was his mindset, and was he pushing to try and cap these or trying to limit some of these? What was his take on this?
Well, as you know, Bernie Sanders, who absolutely detests me and my work, he said it on NPR in different places. I mean, Bernie Sanders, I call him the Pied Piper of single-payer healthcare. Bernie Sanders' goal in life is to get single-payer healthcare. The government would be the only provider of healthcare in this country, as is the case in Canada, where I'm from, or in the UK, where they have a universal coverage with about 88% of Brits on the National Health Service, and there are catastrophes in both of these systems. But Bernie Sanders, because he knows right now that he can't get single payer through Congress, because Republicans have control of the House, he switched to focusing on universal coverage and on price controls on pharmaceuticals. That is his goal right now. But his idea is to rein in the greed of these pharmaceutical pandemic profiteers. It's just not the way it is. And we were so lucky in this country to have a Moderna and a Pfizer to develop these drugs and the boosters, which prevented 3 million deaths in this country, and it prevented 18 million hospitalizations. So, Bernie Sanders, would the pharmaceutical industry would be wiped out basically with new innovative products. And we know Thomas Phillipson at the University of Chicago, who is a terrific economist. I mean, he has shown in his research that there would be 342 fewer drugs from now till 2039, and R&D spending by the drug industry would be $633 billion down because of the ideas and the price controls and the caps that Bernie Sanders wants to bring on the American industry.
Well, when they put these caps on these, the problem is, though, and you're very well with this, you could elaborate more so than I can, but when they put these quote-unquote caps on these prices, they're not really capping it. They're really subsidizing it from the federal government, isn't it? So they're not really losing any money here. They're not really changing anything other than what's coming out of the pockets at the time for the consumer, but the government's so heavily involved on these regulations that, like you said, it harms the pharmaceutical industries, it harms the medical industry as a whole, and it harms the consumer because we're paying for it just through taxpayer subsidized money, where the government's giving them the check and saying, all right, go ahead and put this out into the consumer market now. We're not really addressing the issues when it comes to prices or when it comes to the efficiency of the free market actually doing its job.
Well, exactly. There's so much regulation, from government, whether you're looking at Obamacare and the subsidies, the mandates, the essential health benefits that an insurer has to provide. All of these things add to the cost. But, Moderna, gave the vaccine to the federal government at a very discounted price of $26. Now that you played a little bit, the pandemic, COVID is over. At least it's way, way down. So it's time to move forward, and they're saying that they're going to be pricing their drug at about $130 per dose after selling its discounted price during the pandemic to the federal government. But as Kaiser Health News, which is not a free market conservative organization, has pointed out, that anyone who is on a government program, whether it's Medicare, Medicaid, the VA, the Children's Health Insurance Plan, all of these people and people. These people are all going to be able to, people with private insurance too, are all going to be able to get their COVID vaccines for free. They're not going to be paying $130 per dose. They're covered already. And the other thing is that people that don't have coverage, companies like Moderna and Pfizer, all of the AstraZeneca, they all have what we call patient protection plans, which help those people that can't afford the drugs to get their drugs at a very low price or even for free. So the $130 per dose, it's just wrong for Bernie Sanders to say everybody out there is going to do this, because 130 million American families have employer-based coverage, and then you have 80 million people on Medicare, on Medicaid, and you have about 60 million people on Medicare. So these drugs are still going to be free through their coverage.
Yeah, it's going to cover a lot of us. Sally, we got to take a hard break here. Can you stick over one more segment with us?
Yeah.
Fantastic. It's Sally Pipes with the Pacific Research Institute. When we come back, I want to continue more about this. The plan for the Bernie Sanders utopian healthcare system. What would that look like? We'll do that when we come back here right around the corner of The Voice of Reason.
This is The Voice of Reason with Andy Hoosier. Fighting for freedom every day. The Voice of Reason with Andy Hoosier.
Darn right it is. Welcome back into it. Freedom, common sense, rationale, reason. Things that are difficult to find in society today. That's what we try to discuss here on the program as we talk about the healthcare industry, the pharmaceutical industry, the healthcare vision of some elected officials, which is kind of a dangerous situation to be in. Let's be honest. We're hanging out with Sally Pipes, the Pacific Research Institute, which you can find online at pacificresearch.org. Highly recommend you go and check out some of the articles and pieces from Sally on the website. Sally, if Bernie Sanders had his perfect dream utopian world of crafting the healthcare system however he would like, what do you think that would look like? I know he tries to use the examples of the United Kingdom, like you mentioned, some of the Scandinavian countries for the socialist economy, which aren't really socialist economies. But if he could craft it from a Canadian style, a UK style, what would it actually look like?
Well, Bernie Sanders is a proponent, and has been for many, many years, for a complete government takeover of the healthcare system. So there would be only one provider of healthcare, and that would be the federal government. And as we know, this would be very, very expensive. But it's not just expensive in terms of dollars, and the $34 billion in tax increases that would have to come every year in order to fund it. The problem is long waiting lists for care, ration care, the best and brightest young people not going into medicine, and doctor shortages. So in Canada, where I'm from, where all private health care for anything considered medically necessary is banned under the Canada Health Act. This is the plan that Bernie Sanders wants for this country. There are only 3 countries in the world that have true single payer: Cuba, North Korea, and Canada. So, I mean, isn't that frightening? And the average wait in Canada last year from seeing a primary care doctor to getting treatment by a specialist, 27.4 weeks. That's over half a year. So is it any wonder that over 200,000 Canadians come every year and cross the border into the United States to pay for, MRIs, CT scans, things where they think that their health is at risk. So in Canada, Ontario Premier Doug Ford has just announced that he's going to be allowing the opening up of private clinics in the province of Ontario, the province with the most people, even though it's illegal, because he said it's not fair that people could not get health care. They have to be on this waiting list for such a long time. So this is important. This is what Bernie Sanders wants for this country. In the UK, and also that doctors they work for their provincial government, and so they're paid by the government. They get paid what the government decides that they're going to pay them. And you may be the very best ophthalmologist in the U.S., and I may be the worst, but we get paid the same, and then we will have a global budget of how much we can spend and be paid during the year. If you look in the UK right now, the junior docs under the National Health Service, 61,000 junior docs have gone on strike for 4 days, which means the cancellation of 350,000 appointments and operations over 4 days, and it's just adding to the 7.2 million Brits who are already on a waiting list for care. And so now you're seeing, because Britain does allow private coverage, over 12% of Brits are now buying private coverage. Even the famous Cleveland Clinic has now opened a huge operation in a hospital in London because there's so much demand for people that are so tired of being on a waiting list and not being able to find a doctor to treat them.
Yeah, it must be going really well for them. The fact that their single payer is failing miserably, but yet somehow we have individuals like Bernie Sanders promoting that here on the home front. Last question for you, as we got just about a minute or so left, but the survey that I had seen from doctors, from older doctors who have been in the system for a while compared to younger doctors coming in, there's a big difference on their idea of the future of it, where the older doctors don't want the single payer, don't want more government inclusion, but the younger doctors do. And they like the single payer mindset for whatever reason. Why do you think that is? Or is that even accurate? As you said, with people going into the industry is declining, but the ones that are, they're kind of liking that system. Is it just because it's easy for them to kind of run through the mill and just pop a pill and here you go, see you next time, and not really do any testing? Or what are they being taught in medical school to actually want them to support that type of mindset?
Well, the professors in the medical schools, of course, tend to be, government people. They like the idea of government providing health care. So our young medical students are being inundated with this kind of mindset, and it's very disturbing. Young docs don't want to work overtime. They want to set salary. They don't want to they have to pay loans. So it sounds like a great idea, but it'll be terrible for them and their practice of medicine as time goes on.
The bureaucrats and the administrators, man, corrupting the next generation. Oh, we see that all throughout the education system, and it's sad it's even affecting the healthcare industry.